Welcome to Kaks Bar and Podcast, Canada's first podcast bar. What that means is you can come here for food, you can come here for drinks, you can also come here and record a podcast. Come on down, we're located in downtown Calgary, Alberta in the Beltline area. See you soon.
Great. Thank you. And I'm here today with Francois Gagnon, right? Gagnon?
Gagnon.
Gagnon. Yeah. Oh, I have to do the French accent.
Sorry. If you want, yeah.
Yeah. So, Francois, your website is theotherpainclinic.com.
Yes.
Is that correct? So as a broad overview, Francois is in the health and wellness industry, yet having specialized his role to bring hope for individuals with health conditions, chronic pain, cancer, etc., to regain control in their health and wellness by offering health, lifestyle coaching blended with specific medical, cancer exercises, manual therapies, and nutrition support. They also, so they can maintain their mobility, strength, and have the energy to do everyday activities with families and friends.
Yes, well
right?
Yeah.
Thank you.
Oh, thank you.
That was I appreciate you saying that to me. So my first question is,
excellent.
What was the catalyst that got you involved with this? Was there something that happened within your life that took you in this direction?
Great question. I think there's been an accumulation of different things over my lifetime. So it's anything from even having a personal car accident during high school. And during high school, I was thinking, hey, let's go into business, university, do something like that. But then the car accident happened. And then all of a sudden, it's like I'm in the children's hospital out in Ottawa. And then I have a cast on and stuff is going on. Then it's rehab started. I'm going, oh, rehab, this is kind of cool. It's like, okay, I got to do some exercises to rebuild my strength and my balance and everything else. And I think that started to do a shift in terms of this is kind of interesting and fascinating. It's like, oh, what else can I do? How else can I get involved in this? And then at the time, I'm going, wow, med school, my grades are not so good. So what else can I do? So I'm going, oh, wait, I could play sports or learn about playing sports or coaching sports in kinesiology. So I actually went into kinesiology. And then even in that stream, there's a lot of different programs. So, for example, adaptive physical education was a kind of a stream that kind of opened up a little bit more. So it's people with individuals with Down syndrome, a blindness, deafness. So part of our program was help to coach them through movement and exercise. So like take them into the pool and do all the safeguards. And then there's sports medicine. So there's a lot of things that really kind of compounded over time.
Right. And so then something brought you all the way into this.
Yeah. And then I think seeing family members have health conditions and kind of seeing a decline in their health. And more recently, my father going through cancer treatment as well. And because with my background as a medical exercise specialist, I already had cancer rehab knowledge. And I was kind of going, well, I know the importance of cancer rehab because there's a lot of literature and really well-documented studies about being active or doing specific exercises, but he was not doing that. And I kind of, at one time, questioned the oncologist and said, hey, shouldn't this be part of the treatment plan? And it's part of if your father's up to it. I'm going, so in my mind, I'm thinking it should be part of the treatment plan.
So when then they're going to the specialized doctor, they're not getting told this part of it, or are they? Depends on the doctor?
I think it would depend on the doctor and their knowledge base as well. So that kind of led me to, okay, what else can I do to further my knowledge base as well? So then I got certified as an advanced cancer exercise specialist with an organization out of the States, which was great. It opened up a lot of other doors as well, because I think pandemic kind of did a lot more connections in a different type of way. But then even having a personal training business in Ottawa, having clients with shoulder issues, back issues, knee, hip, and at the time, so I might be aging myself a little bit. So with the Canadian Society of Exercise Physiology, they didn't have what I was looking for. So then I went to the States to get certified as a medical exercise specialist. And that coach there or physiotherapist, we've been friends 20 plus years. So that he's my mentor, and it's been a great relationship.
Is that something that's now grown in Canada a little bit, or are you really one of the not only the first ones, but probably one of the few?
I think it's been growing more in Canada. I see more medical exercise specialists in Canada, like because I have that relationship with Dr. Michael Jones. So he's the lead physiotherapist with the Medical Fitness Institute in the States, and so that's where we connect. We just say, hey, happy Thanksgiving, right? And what's going on? And just July 4th, hey, happy Independence Day. Right? So, and he's always going, hey, when are you coming to Houston? I said, soon.
So
yeah,
I think my big question is I've never, and I've had quite a few family members that have gone through different types of cancers, but I've never heard about exercise to go with it. I mean, I've heard about chemo, I've heard about radiation, and then I've heard of other alternative drugs like apricot seeds. One of them, that was a big thing for a while. But I've never heard about, and of course nutrition, but I've never heard about exercise that you would use while you're going through.
There's actually, it's interesting. Somebody I was speaking with years ago in the States, he developed a cancer exercise kind of program, and he's going, you guys in Canada have a lot of great research. So there's Dr. Kulos Reed at University of Calgary here locally, Thrive. That's a big thing with yoga. I think that's been on the news in the past for yoga and cancer. And Dr. Cornier in U of A as well, big about the benefits of physical activity with cancer. And then in my certification, it was all types of cancers, right? So, and then I know my coach there was saying, try to specialize. I went, that's kind of hard to do. Because I even follow some different groups with, for example, colorectal cancer, because that's a big one, and it's getting younger now in terms of, not typically the 50, but even 40-year-olds are starting to get diagnosed and in earlier stages or earlier lifetime.
Right, like that's something that I think when I was much younger, and I'm not going to age myself. It was something that we thought about when someone was in their 70s.
Yeah, exactly.
And literally now, they're suggesting you go in and get an exam done at 40.
Mm-hmm. Well, I think some of the typical guidelines are still like at the 50-year-old mark, or depending on career as well and what you do in terms of potential exposures.
Right.
So
what would a cancer exercise look like?
So some of the...
That's a pretty broad question. I realize it depends on the cancer, but let's,
So let's say after there's different points of contact, you could do that. So a big one, especially with that company I'm with in the States called Health and Health, they're all about prediction and prevention of cancer. So it's, can you lead a healthy lifestyle to reduce the risk? So that's a big one. So what are you doing in terms of sleep, physical activity? So a lot of times people, they may not like exercise. Maybe it's physical activity. It might be movement. Are you going out for a walk? Are you going out to, like, here we live in Calgary, are you going out to the mountains to do a hike? Or are you parking a little bit further away when you're doing your everyday errands, just to get extra steps in, some intentional movement.
Right, park at the end of the Walmart parking lot.
Something like that,
door. Right.
So there's that point in terms of prevention. And then even if you're going to treatment, I'm working with a client now. She's in the 70s, but she just started treatment. But I said, you're doing movement already, continue that.
Right.
And I was at 3 years ago, I did a podcast with somebody in Australia about breast cancer and exercise. And she's going, I wish I would have kept doing my exercise, because once I got that diagnosis, I stopped. So I said, it's great that she's back on and doing it. But if she would have continued, or just even dropped the volume of activity, let's say, down, but kept something going on, it would have helped with the fatigue management as well.
So that's where it helps so much, because I know, and I just have some experience with some family members that have gone through chemo, and a couple that have gone through radiation. It really, really did affect their activity level, that just even mentally, like to want to get up and get going. And then obviously it affected their appetite and the ability to eat and so many other things. So you work sort of hand in hand with that right away, or to prevent it to begin with.
So in a way to prevent it, if you're going through treatment, if you even do 6 minutes of purposeful movement or intentional movement, just to in a way, it's connections in the body, right? So it's if you move, you kind of strengthen the bones. It could, as you move, it could kind of help out with gut health as well for digestion. Instead of, hey, I just ate, we're sitting down now, and it's like, oh, kind of have that full feeling. It's like,
Right.
yeah. But if we kind of even get up and walk and do some things in the house, just the household tasks, that could potentially help as well.
So start simple.
Oh, it's simple is
Right.
the best way to go. And then even after treatment, and that's a big one, that's where we want to get into, hey, you just went through treatment or maybe surgery. So when I'm following some of these groups, I kind of suggest, hey, have you ever thought about working with a cancer exercise specialist? Some people going, what is that?
Right. Because
So,
when you
and,
messaged me, I was like, what? I've never heard of this.
Yeah. So in a way, in that world, in the Cancer Exercise Therapy Institute, when I went through my certification, we need to do a little bit more in terms of getting known, but that's a process for sure.
Right.
But I know the main, the individual who started everything there, but she's global as well in terms of certification. So that's kind of nice. So it's kind of getting the message out there. It's a kind of like anything else. It's a slow process until you get it going, and you just create more awareness.
And so when you're working with people, are you working with people from all over the globe, or like do you do some one-on-ones here in Calgary?
Yeah, in Calgary, I'll do one-on-one virtually. Like with the pandemic, a lot of stuff shifted to virtual. With Helen Health in the States, part of their group, we're doing a pilot project. So we're kind of delivering virtual cancer care to two different target cities. So it's a couple different outcome measures that we're going to be looking at. And so a lot of it will be education based. So like, let's say the fireside chat, kind of, hey, what are we doing nutritionally? What are we doing for maybe sleep? So, and they're bringing in, that group there's 10 of us as cancer exercise specialists. And we all bring a different background to it as well. So there's, I think, a handful who are survivors, which is great, who are now cancer exercise specialists. So they have that aspect to bring in. Some are with a nutrition focus, and I'm very much in terms of health, lifestyle, and kind of movement and exercise.
So you're predominantly working with cancer patients, or do you work with others like with chronic pain?
Yeah, I work with some others as well. So I have some individuals. One, I'm working with endometriosis. Let's see.
That's not a fun one.
No, headache, migraine as well, because sometimes it's just kind of what can we do for connections as well, movement, persistent concussion. So there's kind of a little bit of everything. It's kind of hard to specialize, and I know a lot of people say just specialize. I said I kind of want to bring hope to
more than
one, and I understand that the specialization, like in the business development world, is like you want to specialize to some degree, but I have a lot of interest of what else could be brought to this health condition that might not be there.
Well, I think also like what works for one also works for the other. Like you say, just movement or just and nutrition. So you don't have to just be down this lane, because that's 10 lanes of 10 different things. Now, you said headaches and migraines, like being in Calgary. I have I have a lot of friends. I mean, I've never, knock wood, suffered from it. That have, when the temperature changes, when we have those Chinooks come in, and they get really, really, really bad migraines and headaches, that literally can't get out of bed for a couple of days.
Yeah.
Do you work with people like that?
Yeah, hopefully through prevention. So there could be some strategies that way. For my fun reading, I actually look at books like, kind of in the Indigo Chapters world or Amazon's, like who's writing about stuff like that. Then I look at, does anybody mention about exercise? Right. Some people do, some don't. Sometimes there could be some foods. So, for example, can we have electrolytes? Because that could be a part of, we need that. Or no, we need that for our body, because we're always told to cut out our salt from our nutrition. But now it's like when you look at the biochemistry in the body, there's a lot of salt equations if you go into the physiology. So do we need some salt to help some actions in the body to be going on as well, to be more efficient? So then it's like, can we do a little bit of electrolytes to some degree? And ideally, in the food world, can we do natural stuff and try to avoid a lot of the sugars, which could be inflammatory?
Right. So with someone who does suffer from the migraines that are
Yeah.
caused by it's a barometric metric
hmm
change, right? So it's a huge drop.
Yeah.
Is there something that you would suggest that maybe they can do to prevent it? And is there a dietary that they could do, or is there something they should change it, or really they need to talk to you directly so that you know what they're eating, what they're doing?
So sometimes we could look at there are potential food triggers. So it's kind of like what is a trigger? So let's say pressure is a trigger, and the drop in temperatures and everything else. But if you're working in a high stress environment, so that could be intertwined in a way. And then if you're kind of like on the go a lot, so your food is kind of not. It's Don't get me wrong, food is food. Like it's important for the body, but can it be a better grade of food? I'll say a little bit healthier option.
Right.
Then, can we clean that a little bit? And oh wait, I'm only getting 3 hours of sleep, so can we help out with the sleep a little bit more? So kind of get into some good morning or evening routines as well. So there's a lot of little. It's kind of like a puzzle. It's like how can we fit more pieces together?
Right. Now, what kind of pushback do you get when you're talking to someone about changing their food or changing their diet, or do you get pushback? Like, of course, they're not really wanting to change too much.
Yeah.
And how do you deal with that?
Sometimes with the pushback, it's I think I learned from one of my coaches. She's a nutrition professional that I've worked with so I could deliver different deliverables for nutrition support, like you mentioned in the intro. From her, I learned it's not really change; it's just add. So it's like, for example, can we add a fruit or can we add a vegetable to your plate?
So it's not about taking anything away. It's like
Well,
just about adding something in, which leaves less room for the other.
add or kind of reduce instead of take away, because I think mentally, if we remove something, we kind of want it more.
Right.
So it's like, so it's kind of like, can we reduce the amount, and then can we add something?
Right.
Or kind of like, hey, I'm not having enough water, but can we tag it with anytime you have a meal, have a glass of water or half a glass. So it's once, like you said before, start small, start simple.
Start simple.
Yeah.
Now, Shawn is probably one of the healthiest people I know. He won't admit to it, but I've watched him make his shakes and all the vitamins, and he works out obviously a lot. Do you have any questions, Shawn?
That's a lot of time commitment for doing that.
Right?
Yeah, Francois, and I don't have to. I can cut this part out of me asking questions, not on a mic. But I'm super interested in everything you're talking about. Like, can you get into a very specific example though when you say like cancer exercise? So say someone had, I don't know, like when Lance Armstrong had testicular cancer, right?
Yeah.
Like were they telling him like cycle more? Like even like that's what I'm trying to.
So
because normally as a layman, when I hear someone has cancer, I imagine like don't do anything.
Yeah. So there is part of don't do anything, and that might be a part because we don't know what's going to happen. But because there's been research out there, there's been books written about it. Like I have a couple of books as well. Like in one of my bigger textbooks, it's all about cancer survivorship, and they kind of like almost like that the book by Covey, 7 Habits of Highly Effective People, and it goes through each chapter: fatigue, this and this, depression, and everything else. And there's a lot of, can we start with small movement? And for most surgeries, I'll say it's hopefully the hospital they do this. It's like you got to move because we want to discharge you. You got to go
Right.
home. You got to move. So can you start with just walking, right? So and then gradually you build that up as well as you go.
So are you basically saying like movement is essentially the key? Is finding ways to make the person still move as much as they can, dealing with the type of cancer that they have. That basically is the message I guess.
Yeah,
not
for
message, but you know what I mean. Like
where we want to go towards
Yeah.
for sure. Because for example, even my father, he went through lung cancer, and I think stage 3, and then with cancer treatment and everything else. So in my textbook for cancer survivorship, it looks at acute side effects of cancer treatment and then chronic side effects.
And so what kind of treatment would he have had? He would have
he
had
got
chemo.
Chemo, he had radiation as well.
And do they do them at the same time or one after the other?
I totally
Usually they don't do them at the same time.
no,
Do
I think
they?
it's like I think I got in more during the radiation stuff, and then
Right.
there was changes in his throat as well, so we had to kind of do puree of foods, so kind of blended foods and everything else for him to be able to swallow. So it's that whole swallowing kind of uh, retraining to some degree in food as well.
Wow.
So there's that, but then for him, it's like, well, let's keep moving, and so he had to walk at home. It's like, Dad, it's like, yeah, to help out with your, it's kind of people say, how do I build more energy, get that energy bank? It's like the, I guess, irony in a way is to build your energy bank, you have to move.
Right. So
That's one of the ways to kind of build your energy bank. So for him, it's like, okay, let's start with 3 minutes. Right. And then he showed me, it's like he was doing some rehab exercises because he developed a secondary effect of COPD. So then it's like, okay, let's do some breathing exercises. Let's do, he was seeing somebody in the hospital for rehab. And I said, okay, it's great, you're doing this option. But if we want more involvement of all muscles, joints and all that for stability and all that, how about we try 2 or 3 reps standing as well? So it's kind of tailored, like a lot of it has to be tailored to where the person's at. Like some people could get back to, if you've been really healthy and then you go in for, let's say, Lance Armstrong, that like a lot of great, fitness and everything else kind of banked already, I'll say. But then it might be easier to kind of start at this level. Whereas some other individuals, like, we're starting at 6 minutes.
Right.
Like even like after COVID, and some people, I remember reading, it's like, oh, I was working out and all that. Oh, I'm okay. I don't have COVID anymore. But then they went back to the gym and they said, oh, well, I can't do the same thing that I was doing because it's like, where's my energy or where's my strength?
Well, I have a couple of friends that suffered from long COVID.
Yeah.
And it really affected their breathing quite a bit. And I mean, they didn't have COVID that bad.
Yeah.
They were sick for a couple of days, but it was the long standing. And so when you're talking about like having like COPD or having lung cancer, would exercises help the lungs? Like you say, a breathing exercise, would that help expand and treat the muscles in the lung?
It could help just to improve efficiencies as well. So, because if there's anything like surgeries or whatever else, so now you got to look at what happened in the surgery. So what type of surgery was it? So then it's kind of like, if there's a surgery, there's going to be scar tissue. And then if there's scar tissue, is there scar tissue rehab? So I'm just looking at all
There's
the
so
little
many
things.
angles.
Yeah, so because I remember years ago, I went to, I think it was UC Foothills. They did a special for breast cancer during the month of October and about surgeries and complications and cool presentation. And in my world in rehab, I'm going, what are you doing afterwards? Right? So because there's like, you're kind of doing various parts in terms of breast surgery. You're taking something from here, putting it up here, or whatever the procedures are. And I'm going, well, what's the rehab afterwards?
Right. I think people forget about that.
Yeah,
I actually even think the patient doesn't even think about that.
Yeah, so then you look at, well, let's say if you had a double mastectomy, now it's a lot of the chest muscle group or the chest wall. Like we had some, pectoral muscle groups kind of were they kind of injured or whatever else, right? So, but now is that person a little bit more kind of into upper cross syndrome? So upper cross is maybe we get that from hanging out in front of the computer too, but it's exactly right. So we get all the shortening here, but now because of the surgery in the scar tissue, has everything kind of changed, and now there's compensations going on in the body.
Right.
Oh, sorry. Just more questions about so again, I'm coming from a layman's standpoint. So for the chest, for the breast cancer scenario, would you be, for the exercise specifically, would be something like do a light chest press with weights, or would it be like, would be like a stretch, or would it be more like a shoulder movement to draw more blood into this area?
All of the above.
Like direct. What exercise? Basically?
So to some degree, we want to work on range of motion for sure. We might look at mobility in the shoulder. So it might not be directly at that area, but it's like, can we sometimes, like even for me, when like come back to headaches and migraines, like, will I work up here? Maybe not. I might work at what are you doing posturally, right? So then it's like, look at the mid back. Look, can we get your shoulders doing the bit better mobility, because shoulders attached to the head via neck and all that, right? So it's kind of, I might look at for lack of a word, a backdoor approach. And so like I've worked with a couple of clients with breast cancer. Then it's kind of, well, yeah, you get some mobility going on. We do a light stretch, like I call it active isolation stretch. So it's like hold for 3 seconds, repeat maybe 10 times. So it's a very short. So we're not getting to like the standard traditional stretches we might know. That might be later. But then it's like, can we work on a lot of the kind of, because muscle groups are in pairs, can we work on the backside muscle groups to kind of get a little bit more strength going on to stabilize the shoulder blades?
What usually is the time frame? Is it like a 20-minute workout once in the morning, once at night, or is it just 45 minutes, concentrate, and then rest of the day recover? like what?
Good question, but I'm going to say it's individualized to where the person's at. So, for example, it might be, hey, at home, can you do 6-minute walks on your own? Then we might do some specific stuff. Maybe, let's say, start once a week. Then it's like, okay, did you do your homework?
Right.
And then it's like, okay, let's add a few more things. So in the past, I worked in health club as a personal trainer. And then sometimes some of my clients are like, I've learned in hindsight, it's like 20 different exercises, right? So it's like, which one's really working, which one's not. So now when I work with somebody with a health condition, it's like, I don't give 20 exercises because it could be overwhelming. So it's like,
Right.
What's 3 of them, right? Can we start with 3 or maybe 5 at the max?
Right. And then add a 4th one once they get going.
Yeah.
They've hit the 3-minute mark. Okay, now we're ready for the 4-minute mark. You can add one more.
Yeah, and then sometimes it's sketching things out in terms of, hey, this week, it's a 6-minute walk. See how you feel. Maybe journal it. And then next week, maybe we add, that we talked about, like the 1% factor. So maybe we add 1 or 2 minutes.
Right.
Instead of in the past, like if we're working out, it might be, hey, I want to improve my time. I got to add another 10 minutes. It's like, that could be too much.
Right.
It just really depends on where the person's at.
So you really work closely with the individual.
Yeah. So
minus judgment and just encouragement.
Yeah. So I think having the guidelines, like through the certifications that I've done, is great. But then a lot of it is, okay, great. We might not be able to do that right now, but we could do this. Okay, we can't do the 10 minutes. Okay, we could do the 5.
Right.
I think my personal view is something is better than 0.
Right. Now, have you worked with a lot of people with chronic back pain? Like I know quite a few people that either have herniated discs and or have had the fusion done.
Okay, yeah.
Right. And even after that fusion, they look like they're in incredible amount of pain. And I'm pretty sure they are. Is there people like that you've worked with and any kind of advice that you would give somebody? Specific exercises? I know Shawn was asking about.
In terms of back conditions, I've worked as an exercise therapist for a few chiropractors out in Ottawa, because at the time it's kind of neat because I got introduced to some specific like spinal stability exercises through one of the chiropractors I was seeing personally. Right. And then I started to work with him, and then it's like, oh, this is kind of cool. It's like, how many other chiropractors don't have an exercise therapist on board to do with the referrals? Right. So that's kind of a really neat venue to go into. And even my certification as a medical exercise specialist, there's a lot of pathophysiologies about different back conditions to help out with as well for exercise. So one of my big ones was actually get into the pool.
Right, because it's so much less on the joints, right?
Yeah, exactly. So I know sometimes people say, well, wait, I don't want to swim. I said, no, we're not swimming. We're going to be like vertical up and down, like standing in the water. Yeah.
We're in the kids' pool.
Yeah. So, and then eventually build up to water, hopefully water comfort. And then the idea would be kind of in the deep end with the water belt, the flotation belt.
Right.
Then we're working at shoulder depth. And then there's a lot of really good research about aquatic therapy as well. So they'd be kind of maybe start there and then maybe look at spinal stability exercises. Might be look at, because of the back and the hip, might look at kind of the backdoor approach as well. Look at some hip mobility exercises, because that could kind of help to, hey, I'm going to focus here, but oh, wait, I'm getting some release out in my low back, as an example.
So what does that look like for you when you're working with somebody, say that it's in Australia, so you're working online. Yeah. So are they exercising literally on camera in front of you? Like, because you do want to make sure that they're doing the exercise properly.
Yeah. With one of the platforms I have, there's actually, they have a data bank of different exercises, which is great. It's done in video, high definition video, so that I actually tailor the specific exercises, and I would send you to you by email and say, hey, did you get those exercises? And then even in that, I have a questionnaire. Let's say it's a low back function type of questionnaire. So I get the individual to fill that out before and after. Let's say a 4-week. It's just to monitor progress.
Right.
And then kind of cool in that platform because I also get a notice if they haven't opened their email. So it's kind of, so for me, it's easy to say either email or send a message to say, hey, how's it going with your exercises? It's like, how do you know I haven't started them? It's like, well, you haven't opened your email and I get a notice. It's like you didn't click on the exercises.
Right.
So that's kind of a good way to like finding that platform. It's done for rehab professionals, and it's kind of like why reinvent the wheel? It's kind of done for me, and I could add in my own exercises.
But is there a way that you're able to make sure that they're doing those exercises properly? Like,
and then
I haven't done a lot of yoga, but I've done a bit. I know like where your hips are, and the teacher comes along and moves your hip a little bit, and oh wow, that made a difference. So is there a way that you can work like that?
So with the online, I think like for example, with the pandemic, Zoom has been super popular. Yes. So it's kind of, can we do something via Zoom and show as best as possible?
Right.
So there's a check-in.
Right.
So hopefully you're doing exercises. I have a way with the platform to say, hey, what did you think about that video? Right. Then I could call out that video that I sent to you via email. And did you do those exercises? Do we need to modify it? Do we need to do a chair version? And then I could kind of via Zoom kind of show a chair version.
A chair version.
Yeah.
So is there anything that I see you've got a little list? Is there anything that we should really talk about that I haven't brought up or Shawn hasn't brought up?
No. Like you mentioned, for me over the years, like from getting to know rehab because of my car accident and
starting as a client.
Yes, sort of, indirectly, and kind of seeing what's happened to some family members over time as well, and evolving because I worked at both in public and private physio clinics, gym space as well. So, and then it's kind of being internships while I was going to school. So it's kind of neat to see different things, going to conferences. I got to an international one in Rome. So it's kind of neat to see what other countries are doing. And then it's kind of, what else could be added, or what can be, what might be missing that could be a benefit. And that's where my approach is doing a lot of integration of different things. So like health lifestyle, like I even have a client by Athabasca here in Alberta, and a lot of it is online, but it's kind of like, hey, I created an ebook for you. And, this is all about how can you have more protein in your day, because we're talking about energy, right? So it's very busy professional. It's kind of like, where's your food intake? So, I had breakfast here. I didn't have supper for 8 hours later, as an example. It's like, well, what can you do for snacks? So we talked about a strategy of healthy snacks, the naps, I called it, right? So it's kind of, we're hanging out here at the bar. So it's kind of having that ready to go kind of snack.
So, I mean, fasting tends to be a pretty big thing. What's her name? Dr. Mindy? I can't think of her last name now. But she's done a lot on fasting. I think more towards women. Have you looked into that? Like, what are your thoughts on that?
I'm going to say I have not looked into it. And I know a couple of friends are doing intermittent fasting. Right. So I think for me, I maybe indirectly do that as well here and there. But I also snack on the go if I can. I think it's a choice for sure. And I know one of my clients, she's very gung-ho on keto, and it's great, right? It works for you. Other people, it's there's a lot of time commitment in keto sometimes. So
yes, I have a friend actually that went keto probably about 5 or 6 years ago.
Okay.
He was rather heavy, and he was diabetic and had high blood pressure, and just decided he was going to get healthy and started moving.
Yeah.
Just started with moving, and he's no longer on insulin.
Oh, wow. That's great.
Yeah, so the diet did change. And I'm not saying he doesn't cheat, because he probably does here and there, but very rarely. It's really changed his life. I did try it, but I love my potatoes and stuff like that, so it's pretty difficult. But even my husband, when I tried it, of course, he was forced to eat it because I was a cook.
Yeah.
Like, I think for the first week he almost passed out like on a daily basis until he got used to it. But he was skinny to begin with, so
So there's a lot of stuff like when we look at changes, like even popular too is plant-based nutrition, and I'm going okay. Even personally, it's like I see the value in that, but for me, I still like the traditional foods, meats, potatoes, and all that
Right.
stuff when I can. At home, it's a combination of Mediterranean, paleo, potential keto. It's just whole food eating. That's what I
Right.
call it. And for me, plant based is like, can I have, like I said, add earlier in the conversation? I said I'm adding a plant based something on my plate,
right.
right? So it's just I'm
I'm
adding
not
it.
telling you to take something
Yeah.
out. I'm going to add something.
Yeah, exactly.
In. So, what about when you're talking about, say, vegetarians? Are they going to be able to get? Let's just say someone's going through cancer.
Yeah.
Are they going to be able to get the nutrition that they need, or do they literally have to add in something that they really don't want to?
I think it might be add in. So like even in the cancer world, which is great with the folks I'm with in States of Health, they have a great website as well where they actually list a lot of resources, like diverse types of nutrition, like with breast cancer. One of the books I even personally have is a Cancer Fighting Kitchen at home. And sometimes I just, for different nutrition, I cook some of those recipes out of there. And it's
So what does
kind of
that?
like whole food, and even some of their teas I make, right? So it's kind of like you're boiling a pot of water on the oven, and you're just adding in your cinnamon, your nutmeg, your cloves, or whatever else, and you're just kind of doing almost like an old school tea.
So what does a cancer fighting kitchen look like? I always open up your pantry.
Oh yeah, no.
What does it look like?
So no, probably my pantry is not a good representation of that.
Is
But
your fridge?
nah, maybe not
Yeah.
either the fridge either. But it's one of the it's a nutrition cookbook that I have on my shelf, and then sometimes it's like, hey, I just wanted to see what they have, because like one of my main staples is chicken, so I need to vary my chicken dish. So I'm going, I'll take a look at that book and say, what do they have for chicken, right? And then I might make that recipe.
Right.
I just it's just.
So do you help your clients too with nutrition, like helping them redo their fridge in time, maybe not all at once, but a little bit at a time, redo that fridge and pantry and that cookbook and all that stuff?
Yeah, so sometimes it's part of it's a lifestyle habit. So
Right.
it's kind of, if we want to change some things, like maybe start with your herb pantry or something like that, kind of clean it up. Kind of look at your fridge to see what you could kind of have like that. And then it's like resources, because I have, the folks at Health, for example, at Health, they research all their stuff before they put anything online. So it's like, great, I know I have really good, reliable resources as well. So then I might do that recommendation as well.
So now for your clients in Calgary, is there any place that you suggest more than others that they shop at? Like, is there certain farmer markets, maybe getting your meat and or chicken directly from some of the smaller producers? Do you do something like that?
Not so much, but because sometimes we might talk about budget, so it's kind of like, you're
that's
so
a big one.
yeah,
That's
so
a big one.
your frozen vegetables are good options. And
Yeah.
is this, as much as you can you still kind of in the grocery store kind of do the perimeter, because that's where you get most of the stuff instead
Stay away
of
from the
in
end
the
of
middle.
the aisle.
Well, I know there's some important stuff in the aisles, but it's
Right.
just kind of, can we shop a little bit more, kind of look at healthier options. And sometimes change just, it takes a while. The habit is 21 days to form.
So not me,
Yeah.
if a person was to say be diagnosed with a type of cancer,
Yeah.
let's just say colon cancer,
Yeah.
which seems to be rather popular in
Getting up there
stomach,
now,
and
yeah.
it's a lot of people with the stomach and colon cancer. What would be the first, other than keep moving? What else?
It might be, actually, I talked about this because this month I'm focusing on metabolism. So I did a small little video about a question I got. It's like, do I keep a food journal? And even because sometimes like, I don't want to write down what I eat, but I'm going, it's like, it's not to be specific about what to have, but sometimes by having a food journal, it actually gives you clues
Of
like,
what you have been eating that you
yeah.
can't
So
realize,
for example, this is years ago when I was doing personal training in Ottawa. I had a client that kind of she's going, I have pain right here, and then low energy. And then I said, so what are you eating? Right? And that kind of, she goes, well, here's what I'm eating. I said, okay, no, just write it down.
Yeah.
And then it's like, kind of writing it down. It's like, I said, oh, okay, this is kind of cool. Then I asked, where's your protein? Like, what do you mean, where's my protein? I said, I have chicken at supper, or fish, or whatever it might be. And I said, so my challenge for you is, can you have protein in the morning? So, and then it's like, all of a sudden, over time, like, I think 2 weeks, 3 weeks later, like, the pain right here, like, pretty much reduced and more energy.
I've been taught a bit the opposite, where I start the day with protein.
Okay.
And there literally is no fruit, because it's sugar, good or bad, and no cereal, no. It's just like eggs and bacon or eggs and sausage. Absolutely. So is that, do you
Have you
agree
heard
with
of
that?
have you heard of the carnivore diet, Francois?
I've heard about it, but I haven't looked into it at all.
Well, that's one that Jordan Peterson does. He does the carnivore, and his daughter. And his daughter was born, like Michaela, she was born with an autoimmune disorder and actually had both of her ankles replaced in her teen years. And it's sort of kind of an arthritis that it causes. And she tried everything, and she went into this carnivore thing and is really doing well. And then her dad got on it.
Yeah.
And he says it's difficult to order at restaurants, but but with it, with his amount of money and his luck now, he probably gets away with it.
Well, yeah, like Jordan basically said, he found out he's essentially allergic to everything, and by default, all he could take in was protein and fats.
Yeah.
And then because he just did a carnivore diet, he naturally fasted because of the way red meat digests.
Yeah.
And I don't know, but it's becoming a bit of it's picking up some steam now. So I was just curious if you heard about that.
Yeah, I've seen it. That's probably maybe when I go on vacation, that's my pleasure reading. So yeah.
Well, and I think the thing that I wonder about it, and I think that was a really great thing to bring up, Shawn, was the carnivore diet. Is I also wonder about when we're not, say, eating just meat from the farms, what else is in our food?
Yeah.
When we think about pesticides and herbicides, and then you think about the GMOs and the packaging of the cereal and everything else, and no wonder people start becoming allergic to everything, because there's a whole bunch of shit in there that we can't even pronounce.
There is, and it's funny when you say we can't pronounce it, and I think that's where sometimes just in my coaching stuff for health lifestyle, it's are you comfortable reading the label?
Right.
Let's start there, right?
Yeah.
So kind of okay, let's read the label. If that looks really super scientific or something else, or it's so many of this, might as well just leave it on the shelf.
Yeah, if you can't pronounce the second word on the label, you should probably put it down.
Or there's just too much information on the label as well. So so I have like a little resource that is specific about reading the label. And sometimes, like if we vacation, it's like, okay, we're reading the label here in Canada, but I need to read the label in the States as well. So it's kind of,
and there's different laws.
Similar, but we need to understand.
Right, and there's different laws between countries of what you actually have to put in the label. And then on top of that, there's scientific names for things that are just sugar.
Oh yeah.
Right.
Yeah,
so it's like, okay, I read this, but I don't know what that is. But it's actually just
sometimes by just with some clients by that doing kind of like, hey, for this week, I just want you to focus on reading the labels. Then it's like, all of a sudden it's like, wow, awareness, like the light bulb is like, okay, I'm taking a little bit more time shopping, but I'm reading the label, and if it's more than 5 things, it's on the shelf.
Are you a label reader, Shawn?
No.
But I think like once we get into habits, like what we know what we're looking for, then we don't really have to read the label.
I stopped reading the label probably about 5 or 6 years ago, but that's also because a lot of it was in Spanish, and I didn't really understand. And I have to say to my husband, now we have the Google thing where you could take a picture and it'll actually translate it into English. And even then, I still don't know what the heck that is. But I do find a difference eating here in Canada than eating in Mexico. First of all, Montesano was not allowed in Mexico. They fought a couple times to get in, and the farmers union went, no. Now, I'm not saying there isn't herbicides or pesticides, because there is a bit, but the food is fresher. So when I usually do, now I've been doing 6 months or 5 months, 7, but I was there for 10 years. When I came back, just by eating normally I gain 15 pounds. And I'm going to say that's because of the stuff that's added into the food. When I go down there, if I'm getting an avocado, I get an avocado.
Yeah.
I'm getting eggs, I'm getting eggs. And like the milk and the eggs are not in the fridge. They're on the normal shelf. Like you don't put your milk in the fridge until after you open it.
Mm-hmm.
So you could have 5 liters of milk sitting in your pantry. Same thing with eggs. Like so it took, at first I was like, what is this?
Yeah.
Right? Because I grew up a different way. What is
Yeah.
this? What do you mean you're not putting your eggs in the fridge?
Mm-hmm.
You know, so there's a lot of, and the cheeses and a bunch of different stuff that, like when I go back,
Yeah.
okay, I don't drop the 15 I put on, I drop 10. But I even eat out there a lot, and I just find the meat's really different. It took me a long time to get used to like the ground beef or the steak there. It was like, this tastes really funny. But then again, it's probably not filled with all the other stuff, corn and stuff that we feed our cattle with.
Yeah, and I think for that, it's partly, especially now, it's budget. What can you go with? Like I know personally, it's like I'll go to a butcher and get my stuff.
Well, I think the butchers are
as-
still there, and that's the difference, is that you still have what you call tiendas. So you have the store that has your bread, you have the store that has vegetables, you have the store that has your beef and your chicken and your butcher, and you do now. Walmart is definitely there, and there's a Soriana and the Chedraui, and they have, you know, and the Megas. They have the big stores, but you still see those small tiendas, and they're still busy.
Oh yeah,
and their price is comparable, and sometimes even less than the supermarket.
Yeah,
because it's cheaper to raise the cattle grass fed than it is to build the barn. And
yeah, like for sure, like even locally, right? It's like, can I find somebody here, like farmers, like especially right now, farmers markets.
It's not cheaper to do it here.
No, it's not. But like in terms of, like in terms of produce, can I go to a farmer's market, support locally, and also do that perspective? So that's this kind of mindset for sure.
Right.
And then definitely shopping, it's, you know, where we can is read the label, come back to that. And you know, if we could kind of make a decision of, I'm looking for a healthier option,
right,
then hopefully that helps out in the big picture.
Right. I'm going to have to learn to read the label a little bit better again.
It's kind of one of those, like,
the stuff you like the most is the worst for you.
Yeah, it's interesting though, because there is sometimes a texture difference in terms of what I pick up at the butcher for chicken or steak versus at a grocery store, like a bigger chain grocery store. And I'm going, no, I'm sticking, like, I'm comfortable, I'm okay with my budget to be hanging out at the butcher shop here.
Right.
So,
is there any butcher shops left here? I don't think so. I mean,
I know there's one off of Edmonton Trail by where the transit station's hub is. Garage. So in there, I go to one on 32nd Avenue Northeast by McCall.
I know there's quite a
golf
few
course, so
young couples that have went out and purchased like a small ranch and starting to do sheep, and cows and eggs, and so there's a lot of people that are ordering. There was one called Shepherd something, but I have a few friends that order directly from sort of the hobby farm, so to speak.
Yeah, no, it's I think nutrition in terms of overall picture for lifestyle is a big part of it. You know, nutrition connects with movement, connects with, you know, how we're doing for sleep as well, connects with mental health as well, because if we're always in a stressed environment, then that could ramp up a couple different things as well. So
if you were going to give somebody some advice as into 3 things that you could just do right now, 3 small things that you could do right now, what would that be? Movement, I would say, would be the first one.
Intentional movement somewhere in some way. Kind of look at a healthier option or kind of evaluate where you're at now for nutrition, and then can we kind of toss this around a little bit earlier too? Can we do 1% better most days nutritionally?
So what about vitamins or supplements? I mean, I know we don't get a lot of vitamin D up here in Canada.
I know that's always discussed, probably in the medical community as a whole, to get vitamin D. If you could kind of bring that in to play, that'd be good. Other supplements and all that, part of it really depends on what are some of your overall health and wellness goals, and if you have a medical condition, does that match? If you're doing medications, does that match with the medication? Just being careful with that. So then that's where you might
have things that do counteract each other.
yeah. So that's where you have to have that discussion either with the physician, or nowadays you could talk with that with the pharmacist as well.
So do you have a little bit of study up on that as well too? So if someone you have like the little sets up a little flag for you, like, oh, well, we need to avoid this.
Yeah, in some of I'll say my assessments, I'll do. We do like a questionnaire. One of the questions is, if you're taking medications, are you following what the prescription says? Right. So they give themselves their own score. Then we do a discussion, and then it's like, are you sure? And it's like, oh, check in with the pharmacist, right? And then all of a sudden it's like, oh, I'm following my medication, but I'm also taking a lot of this stuff for supplements because maybe it's been suggested to them either on an online form or something like that. And that's where it's like, I kind of get into, people are saying, hey, this has worked for me for supplements.
Right.
And then it's like,
well, you should try it.
Yeah, you should. Exactly. You should try it. But I'm going, you don't know their medical history, right? So it's kind of like, and are you a physician? So, right. So it's kind of, you should try it. But I'm going, well, if you're trying it, then I ask the question, did you bring it up with your doctor or your pharmacist? It's like, should I? It's probably. Right. So it's just more of that redirect the accountability to that.
So are you in contact sometimes with some of the doctors of your clients? Like, do they ask you to connect with them?
Sometimes. I also ask, it's like, hey, we're going to be working together. Is it okay if I contact, and then we kind of do like a verbal or a kind of signature that, hey, yeah, it's okay. I send some information and say, hey, dear doctor, this person is starting this. Do you have any concerns?
Right. Oh, that's cool.
So it really depends on the person. It's like,
right.
Yeah.
So we'll make sure then in the show notes to put your website.
Oh, thank you.
And all the ways to contact you. Make sure we get that off of you before you go, in case there's other ways other than just the website. But
there's other ways. Like I mentioned, I just started a YouTube channel as well, because that's one of my goals. And then even in that, I just provide value. And then each month I have a theme. So this month the theme is metabolism. Last month I did muscle for life. So it's kind of different little pockets of themes. And then I'll do some longer episodes or some shorter ones, some common questions or some health tips as well. So.
Oh, good. I'm looking forward to that. So then we'll definitely put the link to your YouTube channel as well.
Yeah, all that would be in the show notes. Hey, Francois, I just got a couple questions just popped in my head. Well, one is, how many clients, like when you're your busiest, are you taking on? Because you have a personal one-on-one touch with each of them, right?
Yeah.
So how many can you fit in, like, with, realistically? I'm just kind of curious.
It's a lot of with clients. It's based on what are their goals. Then we individualize things. So sometimes it's 4 weeks long. So for example, even my client in Athabasca, it's we touch base like a Zoom or a telephone call twice a month, and then a lot of the other time is just via email or a quick message like, hey, how's it going? So it kind of takes up time, but a lot of it is, are you accountable for a lot of your own work?
Right.
So it really depends where they're at. And so for me, it's like a lot of my sessions, like mobility sessions, for example, people think, oh, it's an hour long. It's like, no, it's 30 minutes, because it's very focused.
So it's doable.
Oh, yeah.
It's not overwhelming.
Yeah, so it's kind of, I want you to understand the mobility sequences for, let's say, shoulder or hip. And then it's like, okay, let's repeat it a couple times, make sure we got the pattern down. Great. See you next week. We're going to add 2 more things. So most of the sessions are about half hour. Like if I do something like with a manual therapy, so for example, one of my clients has lipedema, so then it's a manual therapy, so that's like a 45-minute session. So it depends on what the person's coming in with, for lack of a word.
So like a busy day for you, would you have 3 of these 45-minute, 20-minute sessions spread out?
So a busy day would be maybe 3 clients in the morning, 3 in the afternoon, and then because I try to tailor it to the schedule. So, but like, hey, you're hanging out working. It's like, okay, I can see you, at 7 p.m. So I kind of try to modify that, and then in between, then it's work on the business and kind of, nowadays it's like with all the social media stuff going on. So okay, I got to learn this, and it's like, how can I implement that in my business? So, yeah.
Okay. And then my last question right now, you talked about one of your YouTube themes was called Muscle for Life.
Yeah.
Like, what's your opinion on things like testosterone replacement and like hormone replacement and things like that?
That's really important because one of some of the stuff that with a couple of my clients, they're actually going through menopause. So they kind of asked me about that. I said, well, what's kind of your game plan?
So
And
testosterone with a woman going through
no,
menopause,
just
more
like
the
in terms
estrogen,
of the hormone
estrogen
replacement.
or
Yeah.
hormone replacement.
So a big part of that is like, that's maybe one part of something that you might be going through, but then I might look at it in terms of, can you do something with food as well? Yeah. So with one of my coaches, she's been 30 years as a nutritionist specializing in gut health. So one of our we work together, and one of the programs I have is actually functional hormone balance. And it's really looking at some health lifestyle factors, but it's also how can we do food to help reset or reboot the hormones.
Right.
So that's where, we have like a 7-day kind of guided, here's your grocery list, here's the foods that you're eating. Granted, out of 7 days, the first 4, you're eating pretty much the same foods because it's almost like you're doing a detox to your body. And then you would have to adjust, let's say if you're working out a lot, maybe have two of those servings as an example.
So it sounds like you're more on the side of naturally boosting your own production.
Granted, if you need the help with the replacement, then that's go that way too, right?
I guess it's just for people in my whatever gym bro world. Like they're always looking for that excuse to jump on earlier because they want to go on the high normal scale for testosterone. Mm-hmm. But I'm more of a longevity guy, and I've just been like whatever. I'm natural, But I just know right now it seems like the more I do my own research in this realm, it's a lot of doctors they're jumping to firing the dose before increasing something like more fats in your diet because that directly creates the hormone, right? Like things like that. But I guess if you eat very healthy, you live very well. How far do you think a male anyway can push their natural aging before you would say they have to tap and do the testosterone replacement? Because some I guess that question's just been looming in my world because some people are saying, you know what, just start at 40, like whether you're good or not, because you're gonna need it later. And some are like, no, like start at 55 if you've done everything right.
And I think that might be like to go up with your physician and say, hey, can I just get this tested? I want to know my numbers. Right. It might just be that kind of, I want that checked because I remember I was on holidays and I was reading a book by a neurologist in the States. It's all about brain health. And, one of his first recommendations was walk, right? And get your aerobic capacity up for your brain health. And then he said, well, when you go back and you go check with your doctor and get this tested. And then I went back to my family doctor. He's going, why do you want this tested? I said, I just want to see where I'm at, right? Just get that benchmark. So it might be, let's see where the benchmark is. And then, hey, what do I need to, what are my numbers like? Am I low? Am I high? What do I need to adjust?
But even that is so dependent. If I was up all, like right now, I bet my levels are low because me and my business partner, we've been here from start to finish. Yeah. We sleep under 5 hours every night. We have alcohol 7 days a week. Like I've noticed my own energy levels plummeting. Yeah. But then yesterday I slept all day and I instantly woke up with I even felt, I'm like, wow, I feel fuller. But if you can't always get that sleep, then it's kind of hard to get the lifestyle, healthy lifestyle per se.
And then that's where you hopefully what you can balance as best as possible. So it's like, okay, I know I slacked off on my sleep, so I need to kind of regain a little bit of that sleep back in.
Isn't sleep when sleep is where
You
your
do
body
the
heals.
restore, heal,
where
and
you
all
restore
that.
your
Yeah,
muscles, you
yeah,
restore everything in your sleep.
yeah.
So, but I mean, everybody has different sleep patterns
Oh,
too.
for
Like
sure.
I know that if I sleep 8 hours, I'm more tired.
Yeah.
Like I'm more lethargic and more tired.
Usually,
I
think,
need the 6.
Yeah, I think the research shows anywhere from like 7 to 9 kind of optimal. It once again it becomes very individualized as well.
Right.
Like I know some people in shift work, so that's a whole other ball game. So
Like, how much sleep do you usually get?
I might say 5 to 6.
Oh, that's it. Eh?
Like I could try for more. Like some days, like I'll have more. It's just I work in different, for lack of a better word. Yeah, I go into
different time zones.
Not different time zones, but different mindsets. Because
Yeah.
sometimes in the evening, that's more my creative
Right.
side. Then it's like, oh hey, can I start to plan for some of this, like some of the YouTube stuff, what's going to be coming up in the content. Whereas, I work with some clients during the day, so it's like a whole different mindset as well. Or in the morning, it's very, it's task oriented as well, so it gets stuff done at home and just get.
So would that be a good
couple
idea though
different
to
things.
figure out what your sort of sleep habits
Yeah.
are and when you're the most creative, when you're the best at doing the paperwork task and best at doing the other thing? Is that a possibility to be able to? It's got to be something
Maybe,
out there.
but a lot of it is it comes back down to establishing routines as well at night. So, like
Well, it's hard right now for
Yeah.
me and my partner. Like,
Yeah.
like we're trying to get a routine, but for instance, the other night it was 1 a.m. that we had this entire place full from people in the bar industry.
Yeah.
And then that's where we made all our money. And then during that period, we were running around like chickens with our heads cut off. But then that indirectly compounded into even worse sleep because our adrenaline kicked in.
Yeah.
By the time I got home, I could not fall asleep
Yeah.
until I got home by 4, but I couldn't fall asleep till like 6.
Yeah.
And I was back here by 10. And then
Yeah.
I remember I was just a pile of, I was not efficient the whole day.
And then hopefully, like while you're still awake, it's like, can I do some activities to calm things down? So maybe it's like, hey, maybe I'll try some yoga or some
nap.
breathing exercises.
Yeah.
Right. So it's it's
fell
hard.
asleep on that.
Right. Like, you need to have like
But
a little
it-
hammock here
yeah,
somewhere.
So I think that's part of it too, right? And like if there's noticing some patterns, it's like, okay, is this just short term? Can I deal with it? And
Yeah.
can I have some maybe go to things of relaxing music like when you get home, or maybe just like sit down and some breathing exercises to slow everything down. And definitely working with people with health conditions, sometimes it's like their sleep is off or their pain keeps them up. Then it might be, can we go through some strategies of kind of relax, or okay, maybe start reading a book. If you fall asleep, you fall asleep.
Find a boring book.
Yeah, something
to
like
read.
that.
Well, I can imagine though, if you get a diagnosis like that, that's got to keep you up at night. Like it's pretty hard just to lay down and close your eyes and turn your
Sometimes
brain off
because
and go, wow,
your mind
geez,
will be
I have-
like going on as well.
Yeah.
Stress reduction is,
Right.
I find, the hardest thing to control right
Yeah.
now, just because every day is just so unpredictable.
Yeah.
And but that's
But
that's an entrepreneur
yeah.
world. And,
for sure, by entrepreneur world, because it's juggling many different hats for sure. And then it's like, I know personally as an entrepreneur, it's like if I could get a workout in, like even if it's a half hour,
Right.
it kind of grounds me.
yeah,
Right.
yeah. I definitely need that as well. I fit that. I'll be doing one later today. Too.
Yeah.
Yeah. 'Cause
I know. I admire that he goes to the gym every day. I brought a dog.
Mhm.
That's why I have a dog, because it forces me to get out
Yeah.
and walk and take her for a run. If we didn't have a dog, the couch would be my friend, and I'd probably be much larger than I am now. But
sorry.
Yeah.
Francois, I do want to. Is the main thing I can take away from all of your experience and research? You're basically saying, no matter what's going on with the human body, like sick, healthy, movement is basically something you always have to do. That's the kind of vibe I'm starting to get here. Like,
Yeah,
like that's the key to all the
yeah.
healing. And,
movement, nutrition,
movement,
sleep.
sleep. If we could do stress management as well. Like movement is big because like when we think about our day, I remember a guy from Australia, I forget his name right now, but I went to a conference and hearing him speak, and he said, we do 7 primal human movement patterns every day. Like we do a push, we do a pull, we twist, we bend, right? So we're kind of going there. Did we do all that today already?
Yeah.
Yeah.
I mean, open a door,
Yeah.
shut the
Yeah,
door, pull
exactly.
the door open,
Yeah.
right? Yeah.
So
Move the couch,
we always do a squat.
right?
And sometimes some of my clients are like, no, I don't do a squat. It's like, you were sitting down, you just stood up. Yeah, that's one
Oh, you
squat.
drop something on the floor.
Yeah.
Did you go number 2 today?
Yeah.
Yeah, you did a
Something
squat,
like that,
right? Yeah.
Then we always do lunges, and people say, "Oh, I never do lunges." 'Cause,
Wait a minute, how do we do lunges?
I don't go to the gym and do like the classical lunge, but when we walk, I call that the baby lunge because even in the walking pattern, you're kind of almost like doing a lunge step because you're kind of loading the front foot, you're offloading the back leg to some degree, so it's kind of modified lunge
Well, okay.
with our walk.
That's a positive way of looking at it.
And then we always change our gait in the day. So
Right.
because we, for example, outside of here, I had to go up some stairs. I had to manage a curb, right? So you're changing your gait, or here in Calgary, we just had Stampede, so a lot of people. So we're kind of either avoiding people or walking around people,
Right.
or shopping or something like that. So we're kind of sidestepping. So that's where we're changing our gait as well.
So I think we exercise more than
I
we think we do.
Yeah.
Yeah.
I don't remember where I remember this from, but it was one doctor was saying to compliment off of what you were saying. It's like, yeah, sleep, nutrition, and movement. But he said at one point throughout the day, your heart rate has to be elevated from the movement. So that's what he counts as exercise.
Yeah.
He's saying, yeah, you can walk, like you can be a server and walk around the bar, but if you did, I don't know, like just 10 burpees, that elevated heart rate, that's actually like the magic. That's actually what gets everything.
What I want to do is I want to get that question on record because I think it's a good one.
Okay.
So what Shawn was saying was that we've been told, or by different doctors say, is about elevating the heart rate every day to actually at least once to actually hit that level of
because that gets everything in the body going, like your
Right.
organs, everything. Like that's actually it.
of actually burning fat or burning calories or
It's
burning off
kind of-
stress or
it's-
whatever it is.
to some degree boosting metabolism as well.
Right.
And I'll just say, yeah, if my typical is always in the day, let's say due to a chronic health condition, I'm seated a lot. So sometimes that elevated heart rate might be I'm getting up, I'm going to the kitchen, and I'm prepping a meal. So that might, for some people, that might be enough to elevate the heart rate than what is
So you're saying again, it depends on the person, on the situation, on their own health, and so elevating just going to the kitchen. But in a year from now, that could mean actually going out for a walk, going around 3 or 4 blocks. So.
Yeah, or kind of in the house. If you're in a townhome, you have 4 flights of stairs because your basement, washing machine. You're going to get stuff upstairs in the rooms to go bring downstairs to do laundry 4 times or whatever. You're definitely up the stairs. Any incline, you're always going to automatically increase your heart rate.
That's
from
true.
normal.
I had a girlfriend that lived in a townhouse that was sort of kind of about 5 level split. She had the best ass, and when she moved, it was not. She sold and moved into like a ranch style.
Okay.
Actually, because she tore her meniscus and ACL or whatever.
That'd be harder on the knees,
So then she was doing actually the stairs on her butt and up. That was really hard at 5 levels. Getting the laundry, getting to the kitchen. But seriously, she really was in good shape. And then so when she sold and moved to the ranch style, completely changed. And other than that was, I mean, she was active at work, but not active. That was her activity.
Oh yeah, yeah. So it's really like you're saying. It comes down to where's the person at, and a lot of stuff that even with some of my colleagues, right? We look at things and we have the guidelines, we have probably the protocol. We could. Does everybody do the same back program? There's been some research out in Europe. It's like, hey, let's do all the same back stuff. I'm going. A lot of that still has to be individualized to the person and what they can tolerate.
Right.
So a lot of stuff.
Age, size, diagnosis.
Oh yeah. So there's a lot of little
heart health,
factors
lung
going
health,
on.
brain health. There's endless factors.
Yeah, and then that's where it kind of really like sometimes it's like what's most important to you today. And that's where I might work on, because then that now I have a little bit more motivation. It's
Right.
like, oh, this is more important to you. It's like, great, let's do these 3 things.
Right.
So, but yeah.
Perfect.
Great.
Yeah, are we-
Well, I'll just say thank you for coming in.
Oh,
I'd
thank you
love
very
to have
much. It's
a chance
awesome.
to meet and talk with you again.
For sure, I
Maybe
think
sometime in the
we'll.
future we can talk about
Yeah.
doing something like this again.
I
really
think
like that.
even if we do something, if you have like specific health themes, because I know
Right.
I talked to one of my colleagues. We did an interview for mental health, and we talked about the role of exercise in mental health.
That would be really
And I said,
interesting.
hey, we could do stuff like, some themes are PTSD specific or anxiety or depression. And then we could talk about very specific studies that have been done for that health
Yeah,
condition.
because I think talking about anxiety and depression, which seems to be, especially during and after the last
Yeah.
few years,
Yeah, exactly.
I'm not going to name it.
Yeah.
We all know, would be really, really interesting to talk to. So I really appreciate your time.
Yeah, no, because I think that's where a big thing, like the movement piece, it's like there's been so much evidence showing that it really helps out in terms of mental health perspective,
Well-
but it's like that should be part of the treatment plan or the
Very much so.
whole healthcare plan.
Especially when you weren't allowed to go to the gym or weren't allowed to do a lot of the things,
Yeah.
right? And not everyone has all the stuff in their house.
Oh, yeah.
So,
No, but yeah, no, thank you very much. It's awesome to kind of come here and kind of see what you're all about, and this great concept.
Yeah,
for
Right,
sure.
yeah.
There's definitely some irony that we're talking about health and wellness.
Well, yeah. Well, while we're at the bar,
yeah,
Yeah.
exactly.
while we're done here,
but
when we're done
sometimes
here,
it's also about enjoying the moments in life
Right.
as
Yeah.
well, right? So
Yeah.
you can't be like 100% all the time. You've
Yeah.
got to have a little bit of
Yeah.
fun.
Oh, for
I
sure.
know I'll be ordering some potato skins,
Yeah, okay.
but look, it's got onion and it's got
Yeah.
Yeah, there you go.
bacon. It's got
I
tomatoes.
stand by our menu.
Right, exactly. It's all healthy stuff.
Yeah.
It's all made by fresh.
Yeah.
So anyway, thank you again,
Oh, you're
and
welcome.
we'll put everything in the show notes again
Yeah.
for everybody to get in touch with you. And I really appreciate your time.
Yeah, no, I appreciate your time as well. And
Thank you,
everyone,
Francois.
so yeah,
Yeah.
it's awesome.
There you go.
Everyone, bye, everyone.
Bye, everybody.